Can you think of an example or two of how doctors and nurses working together saves patients time and healthcare systems money?
Well, frequently patients will come into the office and they may have very complex needs. As a physician, as we make the diagnosis and we get them under the proper treatment, then a lot of times what can happen is many of my colleagues, the nurse practitioners and the physician's assistants that are part of my team, they work collaboratively with me. As an example, I have a patient who maybe has had a heart attack, and one of the members of the team will call that patient and say, "We noticed that you haven't picked up your refill, and this is why you need to be taking that. Can you please pick up that refill?" Or maybe you didn't get your blood test back, or have it done, or you're overdue coming in for an office visit, and we'd like to call. We may set up that visit with the physician assistant or the nurse practitioner to see how they're doing and coordinate that care. But we all talk across teams, and while they're taking care of that patient, I can go on and take care of another patient, so the patients don't have to wait so long to be seen in the office, and at the same time feel that they're getting care that's focused on their needs.
Your stethoscope. Can I beg that, please?
I do.
It's not here, and I love it because
Okay.
it is one of those idiotic signs. Of course, they use it the other way. What was our question about? Reading the test results. Okay, I know what it is. Our question is, today, there are more choices than ever for patients to get health care. You can go see a chiropractor, you can go see a physical therapist or organic medicine, practitioners. Tell me, with all these choices, what are the benefits of seeing a physician in a physician-led and coordinated care team?
Healthcare has never been more complex than it is today. Patients are living longer, they are carrying multiple diagnoses, and the level of training that is needed to really tease out those life-saving differences for that patient, whether it be interpreting their blood tests, whether it be managing their medications, that requires a significant amount of expertise. And I think physician-led teams can help to ensure that patients have that expertise that's paying attention to their care.
How about in primary care setting? Talk to me about the primary care setting. People come in and have a physical. They just want to check and make sure their cholesterol isn't too high. What's the benefits of having a physician-led care team for primary care? Or is it okay for patients to not see a doctor?
Primary care has become very complex, and I think a lot of people, when they hear primary care, they think sore throats or ear infections or head colds. And there are days that I wish I could have someone on my schedule who had that sort of complaint. Typically what we see is patients with multiple chronic diseases. They require a lot of coordination of care. They require a lot of questioning and very specific physical examination. If somebody's going to come in, for instance, and have a physical for a driver's license, for most patients who are generally healthy, having one of our colleagues do that is entirely acceptable. And that's a good way to get them in so they don't have to wait and they can get the work done. But also, if one of my colleagues uncovers something or is uncertain about something that they've seen, they're always welcome to call me and say, "Would you come in and take a look at this?" And we do that on a regular basis. Or, "Can you help me? What do you think I should make out of this? How should we work this together?" That's part of the team. That's the collaboration that we do together on behalf of our patients.
How does physician-led team in that instance benefit the patient?
Frequently, what we do in the primary care world is we'll have protocols in place where the person who calls up with a certain presentation that may be determined because ahead of time we know what their other medical conditions are, whether or not we think they should see a physician, whether they should see the nurse practitioner, whether they should see the physician assistant. Those protocols are usually designed by the physician but done in concert with our other colleagues, and we agree upon those. What's the standard of care that's going to get that patient the right diagnosis at the right time and not fragment their care any longer.
I liked when you told me about fatigue. Tell me about the patient that comes in. What's the benefit to the patient that has a vague concern who comes into a healthcare situation, tell me why it's important where somebody like that needs to be seen by a team that's led by a physician.
Frequently, especially in the primary care world, people may show up in the office with rather vague complaints. I think the one that probably exemplifies this best is fatigue. And the possible diagnoses for somebody who's tired are about as long as my arm. So asking those very delicate, subtle questions, the nuances of care, that's where the training and the expertise really becomes very critical. After I take that kind of a history and do a physical, I might find out that this is a thyroid problem. I might find out this is heart disease. I might find out that their baby isn't letting them get any sleep at night. There's a lot of different ways that it can play out. And doing a thorough history and physical and having that background expertise lets me do potentially fewer tests, or if I do have to do them, very, very much target the testing that we do so that you get cost-effective care with good quality and good outcomes. And then again, we can share that care across the care team that's led by the physician.
Okay, in the day and age, I'm sorry to ask you this question again, in the day and age of the new technologies that are out there, and healthcare is changing every day for all of us, particularly people who have a history of cancer in their family. In this new day and age of personalized healthcare, talk to me about the importance of physician-led healthcare teams.
I think a lot of people are hearing about the promise of personalized care. It will have a genetic basis to it. It's going to be, if you will, a brave new world in healthcare, but it also has a tremendous amount of cutting-edge science behind it. And being able to interpret that science, by training and by having a very broad scientific training and expertise is going to be important in personalized medicine. How do you take something that is conceptual and really promising, but then bring it home for the patient so that it improves the health of that patient as well as the community? And that's where the physicians will have the training to help to interpret that.
So this notion that you're going to tailor therapy to somebody's individual traits, is this something that you would feel comfortable having patients on the front end of that process being seen by a nurse? I'm not saying it well.
I think I know where you're trying to go.
I guess
Let me just try to figure out how to put it into words.
It starts with a blood test. I'm getting back to everything in the world of personalized medicine. It's going to start with some sort of a blood test, I'm guessing.
We know that in the world of personalized medicine, at least the promise as it's being laid out, is that people will have a lot of genetic testing done on blood tests. And that is most likely going to require a physician to look at that and interpret it. Even now, some tests that I get, there will be abnormalities, and you look at it and you say, that's really not meaningful. I don't need to worry about that. And that comes from training and experience. Otherwise, we could go chasing our tail and put that patient through a tremendous amount of anxiety, pain possibly, and certainly a lot of expense. But to what end? And having the expertise and the background to know what's important and what's important to that given patient will go a long way to making that patient healthier and hopefully to helping society be healthier in general.
Tell me about what your expectations are when you and your team that you work on as a primary care provider. What are your expectations when you have to send somebody off for a referral to a specialty? I'm
a family physician, and so probably 85% or more of what comes into the office we take care of. But sometimes on those very complicated patients, I need some help, and it's important that we all know when we need help. And I will refer to one of my specialty colleagues. That's part of our medical neighborhood. And for instance, as a family physician, if I send someone to a cardiologist, I want to make sure that that patient is seen by the cardiologist. I need their level of training, I need their level of expertise and their experience to really bring all forces to bear to help my patient live a longer, healthier life. And I am very hopeful that sending them to that office, that is a physician-led team. And they certainly can deploy all of their colleagues in whatever way they all feel is best for the patient. But at the end of the day, I need their expertise, and the patient deserves that.
I like that, the patient deserves that. Okay, I hate to ask these again, but you're hitting them out of the ballpark 4,000 times better than you do before. So
good.
For what it's worth, it's good. Talk to me about pain. Today, so many people are faced with chronic pain in one form or another. and they come to their providers for pain management and to be productive. When you have to refer out for pain care, tell me what your expectations are. There's a lot of choices. There's all sorts of providers for pain care, from a massage therapist to an anesthesiologist. What are your expectations?
Well, taking care of patients with chronic pain has a soft spot for me. I have a family member who is afflicted with chronic pain, and I've seen what the implications have been for her and her life, and we are both ever hopeful. When she's had the benefit of having a very good family physician who's helped her to get access to care and treatment and understanding, and trying to not only alleviate pain but alleviate her suffering. Likewise, however, as part of the team of her care, she has a pain medicine specialist, and that physician is someone that if she should need a procedure, they can do that. They can help to guide her in certain ways. And my expectation, not only as a family physician, but as a family member, is that I want my loved one to get the best care that she can get, and her pain medicine specialist is a critical part of that.
Great. What else did we not get that you want to?
The two main ones I was thinking was the specialist referral and the gut instinct. Now, you covered it, but you didn't use the gut instinct
Mine.
when you mentioned it
On the fatigue thing?
on the fatigue thing.
Okay.
Sort of when they come in, because you've got knowledge of the patient or their family, where you can use your gut instinct as well as your education.
Right. So that might be one I'd use on the depression side of it, because we did a fatigue before, but maybe I can. Okay.
Okay, so talk to me in a primary care setting when people come in with they're feeling a little out of sorts. How is something that is kind of vague well covered by a physician-led care team?
If I have a patient who comes into the office and they have a vague complaint, and I'll use an example of maybe feeling depressed, and again, sometimes it might be fatigue, and when you tease it out and you begin to ask all those very pertinent questions, sometimes it's the science, sometimes it's the gut instinct, it's the training that physicians have undergone that allows them to find the right diagnosis for that patient at that time. I might, for instance, find out that that's a patient that I've taken care of her mother or her sister. Because I'm a family physician and we work across generations, I know that the medication that her mother took worked particularly well for her, and that therefore is something that I would be able to deploy for her. That kind of information is invaluable, and it allows me to get the right treatment to that patient in at least a good chance at it at the first visit or the second visit, and not to extend this, to get a timely treatment that's effective and helps that patient to get back to a full life.
And a follow-on. If that patient needs to be referred out for long psychological or psychiatric care, what's your expectation of that patient when you refer them out to other medical teams?
When I refer any patient out for medical care, my expectation is that that's a physician-led team. Whether they're going to see a cardiologist, a gastroenterologist, a nephrologist, or ENT, I want to make sure that they're seeing the physician and that the physician is bringing all of their training and all of their expertise and all of their experience to bear for that patient. I didn't go to the psychiatry intentionally because psychiatry, at least in this community, don't do psychological.
I'm sorry.
Psychologists are very separate, so that's why
And we actually help the psychologists get reimbursement, yeah.
But that's okay.
Sorry about that.
They're where they need to be, so.
Can I have you introduce yourself one more time?
Sure.
And I'm gonna keep asking you before I do long, because I do want to hear about your leadership roles. So, but first,
Okay.
I'm from Pennsylvania, wherever you're from, where
Right.
do you work?
My name is Dr. Wanda Filer. I am a family physician. I work at Family First Health here in York, Pennsylvania. It is a federally qualified health center, and what that means is it's a low-income clinic situation. We have patients from many, many backgrounds, probably 22 languages, and I really enjoy it because these are patients who have been given tremendous life challenges. Frequently, they have very high-risk medical problems, but they also have social problems, and they have a need need that there by the grace of God could be any of us. And I think it's a calling for one of the reasons why I went into medicine, to be able to help people, and not only physically and use my science, but also in human terms, to help them to alleviate suffering.
And do you practice in care teams? And what do you think the value of the physician is in a care team?
We practice in a care team in our setting. I have nurse practitioners who sit right next to me every day that I'm in the office, physician assistants, we have diabetic educators, we have social service folks, a whole group of people who are really pharmacists, who are really brought to bear on these patients' needs. And we try to work to everyone's areas of interest and their areas of training, and trying to make sure that we know the patient, that we, if I'm not there, that someone can see that patient, and vice versa, that the patient can be seen in a timely fashion, that they feel that their meds are need, and they're met in a very respectful manner.
What inspired you to go to medical school?
I've wanted to go to medical school probably since about 7th grade. My mom's a nurse. My mom said, go to medical school, and your mom tells you those things, you do it. So I grew up around the elderly. My mom did a lot of long-term care and geriatric work, and I see patients across the full spectrum, but I very much enjoy seeing older patients. I also see little ones. I had the privilege just in the last few months to speak at the funeral of one of my patients. It was quite an honor. His wife asked me to do that, and I had taken care of both of them now for over a decade. And that's really gives you the chance to give back in a lot of ways, but it's a gift to me as well.
Tell me about leadership roles you've had in healthcare over the years.
Well, I've had a variety of leadership roles in healthcare, predominantly in Pennsylvania. Right now I sit on the board of the American Academy of Family Physicians, but I've also had the privilege of serving as the Physician General of Pennsylvania, which is sort of like the Surgeon General. And the governor at that time said to me, Wanda, you now have 12 million patients, which is a little intimidating. I had the opportunity to serve as president of the American Cancer Society for the Commonwealth of Pennsylvania, and to meet some people who fought very courageous battles and continue to do so, and to continue to win that war.
Excellent.
Do you want to cover why you came to work here in this?
Sure. I moved into this practice actually about 18 months ago. This is a practice where a lot of our patients are at very high need. They are low income, or in some cases homeless. They have very few resources, but when I go home at the end of the day, I know I've made a difference. I know I've made a difference for those patients, and it's incredibly gratifying for me. It's why I went into healthcare. I can use all of my training and all of my science and all of my passion to work systems, and sometimes the systems are not always so friendly to these patients, but we make it work for them, and we try to give them the best patient-focused care in our teams that we can possibly give to these patients, because that's what they deserve.
Congress and state legislators believe that public policy in the United States needs to change so that more people can access health care affordably. Understanding that we have limited dollars and an increase in the number of patients who are now going to have access to health care, what do you think what is the value of a physician-led healthcare team in this new environment?
I think all Americans deserve to be in a patient-centered medical home, a place where they call this their home. They know who to call when they have problems, when they have concerns, or even if they just need to ask a question. But it's going to be very difficult to meet the needs of all of these patients with our current workforce. We need more primary care physicians, we need more nurse practitioners, we need more PAs, but we need to work together. We need to work in a collaborative situation. I believe the team should be physician-led. Many of these people have very complex needs, particularly when they have delayed care for some time. They're going to have some significant diagnostic challenges, and we need to make sure that we have the resources available to meet those needs. When we work together in teams, when I work next to the nurse practitioners and the PAs that I am privileged to work next to, we can open doors for these patients. We can get them seen in a timely fashion. We can let them know that they're valued as people, and we can do the kind of health care this country deserves.
Oh my God. Excellent lobbyist.
What's up?
You're an excellent lobbyist.
Advocate, thank you.
I feel good about that. I had to throw it in for.
That's okay. Feels better here. Feels better down